Welcome to the channel. In this video, I'm going to talk through how you find a physiotherapy programme and what's involved in studying for the degree. So I'll talk through where you can study, I'll talk about some of the placements elements and the other key ways in which you'll be learning. So first up, how to find a programme that really suits you. So it's worth knowing that actually all physio degrees are going to be really similar. And that's because we are all approved by the Health and Care Professions Council, the HCPC, as our UK regulatory body. And we're also accredited by the Chartered Society of Physiotherapy, the CSP. So they both have sets of standards that we need to adhere to. So in that sense, you could go to any physio programme in the UK and you would qualify and you would be more than competent to practice. But each university will have a slightly different flavour, slightly different things that make them unique. And so I'll try and give you some top tips as I go through this, just to be, I guess, things to be looking out for as you're looking at the various programmes and trying to select which one works best for you. So one of the best places you can go to find information on physiotherapy is the CSP website. And on one of their websites, they have a map of the UK. And so you can select different areas of the country by region to decide where you might want to be. And so if you click on that region, it will then give you a list of all the universities that have physio courses in that region. And then you click on the specific university. It will take you through to another page where you get a bit more information from the CSP about that university. But importantly, it also has a link on that website where you can click directly onto the university physiotherapy page. So it's just quite a handy search function when you're initially beginning to scout out where you might want to be studying. The other website that's really handy on the CSP is that it has a list alphabetically of all the different universities that offer physiotherapy. But what's useful about this list is actually you can search for the course you're particularly wanting to study. So for example, if you already have a first degree in a relevant subject and you know you want to do an MSc pre-registration in physiotherapy, that's that 2-year fast-track accelerated approach to studying, then you can actually select that on the CSP website and it would just bring up all the universities that have that MSc pre-reg option. So it's just quite a handy search function to be having. So if you're looking for physiotherapy as a first degree, i.e. you don't have a degree in a relevant subject already, then you're going to be looking for an undergraduate programme. And if you want to find out more about the routes to qualifying for physiotherapy, then please check out my other video where I talk through the different options. But if I say, if it's your first degree, you're looking for the undergraduate options, then the UCAS website is a really good place to be looking. So UCAS stands for University and College Admission Services and pretty much has all of the undergraduate programmes in the country, because you'll need to be applying through UCAS. So have a look at their website, because there you can just scroll through, again, all the different universities listed alphabetically, I think is the way that they do them, and that's a really helpful place to be looking for information. So what is actually involved in a physiotherapy degree? Well, all placements will have 1,000 hours or just over 1,000 hours where you'll be in what's called practice-based learning. Now, these are generally spread out in blocks of between 4 to 6 weeks, and practice-based learning can take the form of clinical placements, so you're actually out there with patients, treating them, learning how to treat them. Or you can also have practice-based learning elements, which could be research, education, or leadership. So in my earlier video, I spoke through the 4 different pillars that we have in physiotherapy practice, which is important for the whole workforce. So just be prepared that when you do a physiotherapy degree, not all of your placements will be clinical, and it's highly likely at least one of your placements will be research, education, or leadership to make sure you develop those core skills for qualifying. So you won't necessarily get a neurological placement, a cardiorespiratory placement such as intensive care unit, orthopaedics, because the reality is actually if you're on an acute placement, for example on a medical ward, you'll likely be seeing patients there that have neurological, that have cardiorespiratory problems as their main reason for the admission. And so in that sense, you're drawing on all your skills around all the different systems of the body that you need to be having to work with people. And so here's one of my top tips. Have a look at where the placements fall as part of the physiotherapy programme, because different universities will do it in slightly different ways. Some will teach you all of the theoretical learning first, and actually the practice-based learning is towards the end of the degree. Others will have your placements threaded throughout first year, second year, third year, fourth year, for example, depending on the length of the course, so that actually your theory is informing your practice-based learning and your practice-based learning informs your theoretical learning in the university. There are advantages and disadvantages to both. At the end of the day, you will still get all of your placement hours. It's just working out what you think will work best for you. I will hold up my hands and I will say that I'm biased. From my perspective, I think it's really important that we try and get students out there as soon as possible in practice, because I think you learn so many transferable skills that you really need the full length of your course to be developing. And as I said, actually, if you're out there in your practice-based learning settings, you're beginning to apply some of those theoretical skills. Even if you don't have your entire theoretical knowledge base, the base that you have to that kind of date, you'll be applying it and learning it. And then when you come back into university, for example, you might be learning about stroke rehabilitation, and all of a sudden you're like, oh, okay, I get that because I saw someone who had a stroke on placement, and so I understand what different tone can feel like depending on how that is affecting a person. So that learning all kind of spirals into each other. But as I say, it will depend on you and how you think you learn best. And so here's another top tip about placement. Are they pass-fail or are they graded? Again, different universities will do this in slightly different ways. Some placements, you do your placement at the end of that, you're given a pass, or you fail it and you have to resit the placement. Other universities, you do your placement, and at the end of that placement, your person who's been supervising you in practice, often called a practice educator, who will normally be another physiotherapist, they will give you a grade depending on how your performance has been throughout the whole length of that placement. So as I say, there are advantages and disadvantages to both of those. The pass-fail placements probably are less pressurised because at the end of the day, you just need to do enough to be able to pass the placements. But again, that can be a disadvantage because if all you've got to do is enough to get over that kind of pass mark with placement, you're not necessarily going to be giving your everything to placement. So it really will depend on you and what you think works best for you. But I just think it's important that you're aware of and you're asking questions around that when you're considering which university you might want to be studying at. So we've spoken about placements as part of that learning structure at university. Now let's look at what else you can expect from the university side of learning. And I just wanted to say, if you're enjoying the learning from this video, then please hit subscribe so that you won't miss out on any future videos. So aside from placements, you'll have a mixture of lectures and probably skills-based learning when you're in university. So with lectures, that can be you go into a lecture theatre and the lecturer is there and they will tell you information that you need to know that's relevant to that particular topic they're talking about. The expectation is that you then take notes on that so that you can be using that for your revision and for review later on. The other way lecturers can do their learning lecture part of it is actually they might do some pre-records and they expect you to watch those before you come to your university sessions so that you can begin to apply some of that learning straight away. So different lecturers will do this in slightly different ways. For example, I rarely do that traditional chalk and talk lecture, and that's because actually I think the time that I spend with my students, I would much rather spend that time with them applying, consolidating, talking, developing their learning, rather than students just having to listen to me talk. So be prepared that there will be that kind of lecture preparation stuff that you have to do, and that might be pre-records or it might be face-to-face lectures. So have a think about that as part of figuring out where you might want to study. I'll talk through those expectations around lectures and learning a little bit more in my expectations of studying a physio degree video, but I suppose I just wanted to give you a heads up that as part of those lectures there will be lots of opportunities probably for shared learning and working in groups so that you can be learning from your peers as well, because that's an important part of you consolidating your learning. You can also expect to be doing what we call case-based learning. So that's when you get given a mini case study about a patient and you might have their signs and symptoms, some details around their history, and then your job is probably to work with your peers in a small group, figuring out actually, okay, based on the learning that I have so far, what do I think this patient's problem list is going to be and what would be the best management treatment plan for that patient? And then you could potentially practice doing those treatment plans. What exercises are you going to prescribe as part of that treatment with your peers so that you can be applying the learning? Self-managed learning will also be part of your programme. So that could be, as I've touched on already, maybe watching a pre-session video before you come to the lecture. It could be reading a chapter from a book. It could be reading a research article. But it's really important that you develop those self-managed study skills, because as a physiotherapist, you will be a lifelong learner. So we call that part of our continuing professional development, and it's important that you develop those study skills while you're still a student at university so that you can maintain those skills as you go on into qualification. My top tip: craft yourself a really cool study space. I appreciate some of you might be staying in university accommodation in your first year, so you might be a bit limited for options, but if you can set up a cool study space, it will just motivate you more to want to sit at that desk and be there and do the work that you need to do the career that you love. Skills-based learning is also a really important part of your physiotherapy program. So that's when you'll be working in a room with your peers. It tends to be quite a large study space. There'll be plinths down either side of the room, and that's where you get to do those real hands-on skills. So it could be learning to palpate the bones of the ankle. It could be around learning to do a special test to see if someone has injured their ACL ligaments. It could be learning to use a stethoscope so that you can hear the breath sounds, to be figuring out what's going on with someone's breathing. Or it could be you're teaching someone how to use crutches for the first time. So these are the practical bread and butter skills you need as a physiotherapist, and is a really fun part of your training. Next, I just want to talk a little bit about reflective practice. So there was an American philosopher and education reformer, and he's called John Dewey. And he says, we don't learn from experience, we learn from reflecting on experience. So, for example, you could be on placement and maybe you're helping someone get out of bed for the first time after they've had an important surgery. And actually you check all their obs, their BP's okay, their heart rate's okay, their oxygen levels are fine. So you think, great, this is fine, this is going to be safe to get this person up and moving. And then you get them up and all of a sudden the patient goes really dizzy and you have to shout for help to get the person back into bed safely. Now, when that happens, that can be a really daunting, challenging, scary experience as a physiotherapy student. So what you don't want to do is just be, I'll just chalk that up to experience and hope it doesn't happen again. No, you need to really reflect on that experience and say, actually, if this does happen again, what would I do differently next time? And how am I going to make sure I keep my patient as safe as possible? Was there something I missed when I was checking things? Was there an interim stage I needed to add in? And so those are the things that actually, when you reflect on it, you can really accelerate your learning and you will get better a lot quicker. Reflective practice is part of our physiotherapy practice going forwards, so you will have to do reflective practice for the entirety of your career. So learning to do that well at university is an important skill to acquire. The other important part of the structure of a physiotherapy program that people are not always aware of is the importance around learning from service users and carers. So we will often have a number of people who've experienced physiotherapy themselves, or they're a carer for someone who's experienced physiotherapy, come in and talk to students in the university setting about those experiences. Now you may think, well, okay, but I get 1,000 hours out in practice working with patients and service users. But the reality is, when you are in a placement setting, there's always going to be a bit of a power dynamic, because that patient might be dependent upon you to be providing their therapy, to get them discharged from hospital as soon as possible. So they're not necessarily going to give you honest feedback on their experiences maybe of working with you, or just what that experience is like for them. But actually having them come into the university and tell their story about their experiences of physiotherapy is a really powerful learning tool for you as student physiotherapists, because you understand their perspective so much better. So when you're out on placement seeing patients, you will have far more empathy for them. And in fact, I did a piece of research that said universities that do involve service users and carers as part of their training really help students develop skills in person-centred practice. And that's a really important attribute for physiotherapists to have, because person-centred practice means you're making sure that actually that patient, that person is the centre of what you're doing, and you're making sure that you are taking into account their hopes, their expectations, the unique parts of them, to tailor a physiotherapy programme that is suitable for that person. So so learning from service users and carers, again, can really help accelerate your practice. So I hope this video has been helpful in helping you find a uni and learn about all the different parts of a physiotherapy program in terms of how we teach. In the next video, I'm going to talk through top tips for things to be looking out for at open days. So if you like what you've seen and you're enjoying the learning, please hit subscribe. And if you've got ideas for other content, please feel free to leave it in the comments below and I will do my best to address those. Thanks for watching.